Welcome back to eCW Podcast. I'm Brian Saul. Today we're in Carson City, Nevada at Carson Medical Group with Dr. Amy Hayes. Thank you for being with us today, Doctor.
You're welcome.
Today I was hoping to talk to you a little bit about the patient portal and your adoption of it here at Carson Medical Group. From what I'm led to understand, you are one of the top providers who have, I don't want to say web-enabled people, but who have brought patients onto the portal. What's your experience been like with it?
Well, I love the portal, and more importantly, my medical assistant loves the portal, and that is a big part of how I sell it. I explain to patients that by utilizing the portal, they can communicate with us 24/7. They never have to talk to the girls up front. Much as I love my front office people, they should be doing other things rather than taking phone calls. And so people can send me messages. I can see those messages and respond to them without interrupting my patient flow and without playing phone tag with patients. So it takes me about 30 seconds at the end of every visit to discuss the portal with my patients. If they're logged on and they don't know their password, I reset, then print out their password for it, hand it to them, and explain to them how easy the Helo app is to use. Because then I pull out my phone, if they look dubious, and show it to them and say, look, don't look at the picture, but here's how to use it. And especially with my OB patients, we are talking to them frequently about lab results and information, so almost all of my obstetrical patients are on the portal. That's just an expectation. But even with my regular GYN patients and surgical patients, it's nice to be able to have interactions without having to go through the hassle of calling the service or calling the front office and then playing phone tag. I know I sound like I'm repetitive about that, but it's a pet peeve of trying to make phone calls and missing people and leaving voice messages, and then they leave me a message. And
there's only so much time in the day.
This is true.
And you want to utilize it as best you can. Was it easy for you to adopt it, to begin using it? Did you have any difficulty getting patients to go on board?
There was a little pushback at first. People were a little worried that it wasn't secure. And there were several people who thought it would be difficult. And once I was able to show them the Helo app, then they don't have to remember their login and their password. And I think the fact that I tell people I use it and I hand them the piece of paper and say, this is really important, and this allows you to have a direct line to my assistant and me. Is useful.
Yeah, that there really is a direct connection between, without having to go through, as you said, a middle person, one of the front office people. So that I can see how that could definitely increase communications. If you were to speak to another provider who's not using the portal, what would you tell them? How would you try and convince them to use it? I know that you've just said all the wonderful things that it's helped you with. But is there anything else that you would tell another provider?
One of the first things I liked about the portal and that mode of communication was I could see directly what the patient's question was. And then I could read, before I hit send, what I'm sending back to them. So there's no confusion about whether we misunderstand each other in the telephone game or whether they don't hear what I'm saying. They're getting a written transcript of what I want them to see. It also allows me to proofread.
Well, no, that's a very good point, because anytime you're on the phone with anybody, it's very easy to misunderstand, particularly when you're nervous talking to your provider. I could have sworn she said take 3 of these, but now I'm looking at on the portal, it only says take 1. I'm glad I looked at that. So, yeah, that I can see how that could clear up some problems with communication. So you're comfortable with the portal now. Moving forward, what would you like to see the portal be able to do for you?
Well, I'm excited about Helo Mom coming up. Although I haven't gotten a chance to utilize it yet, I think that will be a huge improvement for our obstetrical patients. I think having the app has made it a lot easier for people to log on. And so whatever we can do to make that interface easier for patients, I'm looking forward to hopefully getting our patients onto the portal while they're here in the office in the future, near future, hopefully with our group. And I think the more people are able to use this, not only for messaging, but also for looking at their results. I tell all of my parents that they can get their kids' immunization records which is huge.
big.
I mean, that's going to log all those pediatric patients on just so they don't have to call the office and swing by and get a copy. There are so many little utilities like that. I have my patients use it for tracking their different blood sugars, vitals, blood pressures at home, weight. There's so many new things I think will be coming from the preview we got at the national meeting.
Yeah, the trackers like Fitbit and things like that, which are being very nicely integrated into the system, and I think give real-time data to you, along with, as you mentioned, blood pressure. We're automating that for certain types of cuffs and so forth. So that I think that's definitely coming your way in the
Yeah, I'm
very
looking
near
forward
future.
to more ways I can convince people to utilize it. Will keep them from having to call the girls up front. I really like my front girls, but they just get inundated with phone calls, and
Sure. And there's, as I said earlier, there's only so much time in the day.
that's true.
And you have to utilize it as best you can. Thank you again for being with us, Dr. Amy Hayes of the Carson Medical Group here in Carson City, Nevada. I'm Brian Saul for the eCW Podcast. If you're interested in additional eCW podcasts, please check us out at myclinicalworks.com, YouTube, or on iTunes. Thanks again for being with us. Take care.
This broadcast and its contents are the sole property of eClinicalWorks and are protected by federal law and international treaties. You are strictly prohibited from making a copy of, modification of, or form of rebroadcasting or re-encoding this broadcast without prior written permission from eClinicalWorks Public Relations, except as may be permitted by law. This broadcast is provided for informational purposes only. It is intended as a personal, non-commercial use. Product specifications are subject to change without notice. Please contact eClinicalWorks Public Relations with any questions. eClinicalWorks V10 EHR is ONC HIT 2014 edition certified as a complete EHR. eClinicalWorks V10 CC 2014 955447-1.